and modify. Stop, drop it low, but pick it up carefully. Work them glutes like you in physical therapy.
Bismillahirrahmanirrahim. Assalamu alaikum viewers, welcome to my channel. Today in this lecture we will learn about the abdominal wall and anatomy of the abdominal wall. So abdomen is basically a region between the thorax and superior and inferiorly it is found as the pelvis, while the wall means the boundary. So there is a group of structures that form the anterior and posterior boundaries of the abdominal cavity, which is called as the abdominal wall simply. Okay, this is the abdominal wall, or this is abdominal muscles, anterior abdominal wall. So now abdominal wall can be of the anterior abdominal wall and can be of posterior abdominal wall. First of all, we will start above the anterior abdominal wall, which is a group of tissue that are found on the anterior surface of the abdomen, including the skin, the fascia, superficial fascia, which is also called as camper fascia, and the deep fascia, which is also called as Transversus fascia, the rectus sheath, the muscles, the transversalis fascia, and the external peritoneal and the peritoneal layer, parietal peritoneum. So these are the structure, as you can see, from anterior to posterior, the skin and these all structures. So first of all we will discuss about the skin. Skin is the outermost structure which is loosely packed and at the anterior side of the abdomen, except the umbilicus. So the nerve supply from of the skin is from the anterior rami of the spinal nerves, and which is innervated by the lower 5 intercostal nerve, the subcostal nerve, and the lumbar nerves, which include the iliohypogastric and ilioinguinal nerves. So as we can when we talk about the innervation and the specific points of the nerves which supplied the specific part of the skin, which is also called as dermatome. So dermatome, the xiphoid process is the area which is supplied by the T7 thoracic vertebra, while the umbilicus, or below the umbilicus, is the region that is supplied by the lumbar first dermatome. So these are the dermatomes, the lines. These are all the innervation of the skin. So now we will talk about the blood supply of the skin, which is generally the common in the anterior abdominal walls. So the superior epigastric artery, which is the branch of internal thoracic artery, and which is further the branch of the subclavian artery, and there you can see the inferior epigastric artery, which is the branch of the external femoral artery, which then goes upward and anastomoses with the superior epigastric artery. Then we are having the lumbar arteries, which arise from the abdominal aorta, and there is the intercostal arteries, which also arise from the posterior abdominal aorta. Then we are having the deep circumflex artery, which supply the which is the branch of the external femoral artery. Superficial fascia is basically the layer of the loose irregular tissues which contain mainly of fats, and this is the fascia which cover the abdominal, and it carries on and enters into the scrotum as well as the anterior side of the thigh. It can be of 8 centimeter and 3 inches, or it is in more in the obese patient. This is the fascia where the fatty layers occur in the abdominal, and this is also called as the Camper's fascia. So this is the layers, as you can see. The upper one, the skin, when the fascia enters into the scrotum area, then it is the skin. Then below the skin there is the fascia, which is called as daughter's fascia and a muscle. Then we are having the external spermatic fascia, the cremasteric muscle, the cremasteric fascia, the internal spermatic fascia, tunica vaginalis, and which is having 2 layers, the parietal and the visceral layer. Then we will talk about the deep membranous fascia, which is the which is also called as Carper fascia. It is basically a thin layer of tissue, and which fade out laterally. It covers the muscle above the investing fascia. So as you can see, these are the deep membrane. This is superficial. From here to onward, this area is superficial fascia, while from here to here posteriorly it is called as the deep or membranous fascia. Now myofascia is the as the name suggests, the myo means muscles and fascia means the loose irregular tissues that cover the muscles. So fascia that cover the muscles of the abdomen is divided into the superficial fascia, intermediate fascia, and deep fascia, which make the myofascial lines. That is, you can see here the external oblique muscle, internal oblique muscle, all of them are surrounded by the fascia. So they make the anterior abdominal the anterior myofascial line, the lateral myofascial line, the transverse myofascial line, and the posterior myofascial lines. So anterior abdominal wall muscles, now we will talk about them. It involves the following muscles: the external oblique muscle, internal oblique muscle, the transversalis abdominis, and the rectus abdominis, the pyramidalis. So these are the muscles we will look at them one by one. So first of all, we will look about the external oblique muscle. It is the muscle which is having the nerve fibers traveling downward. So you can learn it by remembering that the external oblique muscles is the muscle when I put my hand into my pocket. So the fibers of the external oblique muscles are running downward, like when you put your hand into the pocket of your hood or your jacket. So it is originated from the lower 8 ribs, as you can see here, from the lower 8 ribs, and then the xiphoid process, and it goes insert all the way from downward from the process of pubic symphysis and the iliac process here, the pubic crest here, and the tubercle of the pubic. It is its main function is when it contract one side or laterally, it gives the lateral bending, or when they contract bilaterally, so it will give the spinal anterior flexion. And it also help in the micturition, like the peeing and the vomiting, the pregnancy, when the labor pressure is given by the external oblique muscles, internal oblique muscles, and the transversalis muscles. Okay, so it's also help in the defecation, expiration. Now we will talk about the internal oblique muscle. Internal oblique muscles which originate from the lumbar fascia, iliac crest, and lateral 2/3 of the inguinal ligament, as you can see here. So its fibers are originating upward, like you can see here. So the muscle origination is this, while the insertion upward, like because their fibers are moving upward. So it is inserted into the xiphoid process and the lower costal cartilages of the ribs. It is having the same action as the external oblique muscle. So transverse abdominis is the next muscle which we will learn about. It is called as the transverse abdominis muscle because its fibers are traveling transversely. So this is called, that's why it is called as the transverse abdominis muscle. It is originated from the internal surfaces of the costal cartilage 7 to 12, and the thoracolumbar fascia here, and the iliopectineal line from here, and it goes all the way inside or medially, and then insert into the medial line. So as you can see, the insertion is on the linea alba aponeurosis of the internal oblique muscles, and the pubic crest here, and the pectineal line of the pubis over here. Its action, when it contracts bilaterally, it compresses the abdomen, the viscera, and it also helps in the expiration and the unilateral contraction and the trunk rotation when it contracts unilaterally or ipsilaterally. It is innervated by the intercostal nerve 7 to T11, T7 to T11, the subcostal T12 nerve, the ilioepigastric and ilioinguinal nerve, which is also called as L1 and L2 nerves, which originate from the lumbar plexus. The next muscle is rectus abdominis and rectus pyramidalis. Rectus abdominis is this muscle, as you can see here. This is the muscle, its fibers are moving upward. So its origination is from here and insertion is here. So it is originated from the pubic symphysis, the crest of the pubic symphysis, and insert on the xiphoid process and the lower costal cartilages. Like you can see here, the pubic symphysis, and it goes upward, insert in the xiphoid process and the costal cartilage of the 5 to 7 ribs. It is innervated by the intercostal nerves T6 to T11, the subcostal nerve, which is also called T12 nerve, and its function is when it contracts, so it gives the trunk flexion and compresses the abdominal viscera, and is also help in the expiration. The pyramidalis muscle is a small muscle over here in this region, which is inserted, which origination is from the pubic crest, pubic symphysis, and is inserted into the linea alba. It is innervated by the subcostal nerve, and its function is to tense the linea alba. Okay, so linea alba is basically the dense connective tissue which is found in the median side of the rectus abdominis muscle. That's why it is called as the linea alba, and this is the dense connective tissues or the aponeurotic tissue which found in the transverse below the rectus abdominis muscles. This is called as the transverse, and the lateral side, as you can see, this dense connective tissue which run laterally, a bit laterally, or you can say that it is running in the sagittal plane. It is moving in the sagittal plane, so that this dense connective tissue or this line is called as the linea semilunaris. Okay, so nerve supply of the anterior abdominal walls is from the thoraco-abdominal nerves T7 to T11, while the T12 nerve is called as the subcostal nerve, and there you can see the iliohypogastric and ilioinguinal nerve, which is the branches of the lumbar plexus. So the blood supply of the anterior abdominal wall is same as the blood supply of the skin. It is the blood supply, it gets its blood supply from the deep circumflex artery, the superior epigastric artery, the lumbar arteries, and the intercostal arteries. Okay, so the rectus sheath is the it is also called as the abdominal aponeurosis. It is formed by the tendon of the external oblique muscle, internal oblique muscle, transversus abdominis muscles, which is found anteriorly. It digests or it covers the rectus abdominis muscle and the rectus pyramidalis muscle. There is a variation in its pathway above the and below the arcuate line or pectineal line. So as you can see here, this is the external oblique muscle, this is the internal oblique muscle, and this is the transverse oblique muscle, transverse abdominis muscle. So the tendon of the external oblique muscle passes anteriorly to the rectus abdominis muscle above the arcuate line, while the tendon of the internal oblique muscle passes anteriorly and posteriorly to the rectus abdominal muscle, and the transversalis muscle, the tendon is passing posteriorly to the rectus abdominis muscle. This is the variation which is found above the arcuate line, which is found in the pelvic muscles, while the below the arcuate line, all the three tendons of the rectus, the abdominal muscle, anterior abdominal wall muscle, they are passing anterior to the rectus abdominis muscle below the arcuate line.